So now we're going to move on to the cosmetic stuff, and we're going to talk about photoaging and different procedures that we have. And you know, we start off when we examine patients by looking at the tone and the texture of patient skin, and then this Dr. Glogau was a famous dermatologist in California. He developed the Glogau Classification of Photoaging. And a type 1 patient is somebody who has no wrinkles, and that's probably like your kids and grandkids. You know, so we're talking about young people, teens and preteens. People who have type 2 are people who, when their face is at rest, they don't have any wrinkles, but then when they start using their muscles of facial expression, they smile and you can start to see little crow's feet around their eyes, that kind of thing. A type 3 person is someone who has some wrinkling at rest in areas of expression, and somebody who's type 4 is somebody who has wrinkles even in areas where the skin isn't moving. So if you start getting wrinkles like in here, which is kind of sort of like a non-movement area, then that would make you a type 4. So as far as what we do, you know, I like to keep things really, really simple. There's the 3 P's. There's prevention, there's products, and then there's procedures. As far as prevention goes, avoidance is probably the most important thing. You know what they say about an ounce of prevention being worth a pound of cure, right? So we recommend staying out of the sun and staying away from tanning beds. Interestingly, the thing about tanning beds is that the tanning bed industry used to tell people, oh, tanning beds are safe. And, you know, I told you all about the recent study with the melanoma increase in incidence. But tanning beds emit mainly ultraviolet A. And one of the things about ultraviolet A is that it penetrates deeper than ultraviolet B. And ultraviolet A really is more responsible for causing wrinkles than ultraviolet B. So, you know, every time I drive past a tanning parlor and I see a big sign that says tans on it, what I envision is a big sign that says wrinkles, because that's really what they're selling to you in addition to a little bit of unsafe color. And then obviously using sunscreen. So I just want to spend a couple of minutes talking about sunscreen. You should put sunscreen on every time you go out in the sun. You should put sunscreen on anything that's not covered by clothing, all right? And you should reapply it every 2 or 3 hours if you're silly enough to spend more than that amount of time out in the sun. You know that I personally recommend sunscreens with an SPF of 50 or higher, and they need to be broad spectrum. And the new labeling that the FDA is mandating will say, it has to say on the label it's broad spectrum. Broad spectrum means that it screens out UVA and UVB, not just UVB, all right? So that's very, very important that it be broad spectrum. And the reason that I tell patients to use an SPF of 50 or greater is that when they do the studies to determine what the SPF of sunscreens is, they probably put about 2 or 3 times as much sunscreen on as what you use when you're out on your boat. So you can take that number and cut it in half, and that's probably what you're really getting. So if you put an SPF of 50 on, you know, you're probably getting about a real SPF of 25. And there are a lot of great products on the market now. Sun protection factor is calculated by, it's the amount of time that it would take your skin to get red, protected, divided by the amount of time it would take your skin to get red, unprotected. All right? So if it normally takes 5 minutes for your skin to get red without sunscreen, all right, and you put on a SPF of 10, it should take 5 times 10 or 50 minutes before your skin gets red.